Welcome to today's lecture in the Public Health Through Time series. This lecture will study why the NHS was such a significant turning point in the development of British public health. This lecture will be split into 4 parts. The first section will study the Beveridge Report of 1942 to understand the rationale behind the creation of the NHS. We will then examine the birth of the NHS and why this was such a significant turning point since it provided free healthcare to all. We will then examine the opposition that the NHS received, especially from private doctors at the time. We will finally examine the modern-day challenges of the NHS to consider whether it has become a victim of its own success. Sir William Beveridge was responsible for publishing a very important report into the public health of the nation in 1942. He was a Liberal politician who was working on behalf of the wartime government, which was a coalition between the Liberal and Conservative parties. Before World War II, England, like the rest of Europe, had suffered through the Great Depression, and this had meant public health conditions had deteriorated for many families. The young men had then been conscripted into the worst war of history, and deserved a higher quality of life on their return. The Beveridge Report focused on 5 areas of need. These were called the 5 giants of poverty. These were squalor, otherwise known as poor housing, ignorance, or poor education, want, which means financial need, idleness, or unemployment, and finally disease. These giants of poverty show clear stagnation in public health since they had been identified a century earlier in Chadwick's report in 1842 on the conditions of the poor in London. They'd also been identified in the reports of Rowntree and Booth, relating to those living under the poverty line. This shows that despite the public health legislation in the second half of the 19th century and the liberal reforms at the start of the 20th century, the Beveridge Report made several suggestions to establish a welfare state in Britain. A welfare state is a government system whereby the state undertakes to protect the health and well-being of its citizens. You pay into the system through taxes, and you receive back from the system when you need it, regardless of how much tax you have paid. Beveridge suggested that this welfare state should provide social security. This means that nobody should be allowed to fall into abject poverty, as they should receive benefits from the state to assist in housing and living costs. This includes a basic pension for the elderly so that they could retire with dignity. However, the most important part of the report was the suggestion that the government should provide a national health service that allows access to free healthcare to all at the point of entry. This would then be paid for by people's national insurance contributions, but the service would be equitable regardless of how much an individual paid into the system. There was debate in Parliament about whether the paper should be released. The Conservative Chancellor of the Exchequer stated that it provided an impracticable financial commitment. His opinion was overridden, however, and the report was released to the public. It was received with widespread popularity across all social groups, as many hoped that the creation of a proper welfare state would herald in a new world. Despite this, Winston Churchill made a speech in 1943 about life after the war, whereby he pressed on the public to not vote for great new expenditure on the state without any relation to the circumstances which might prevail at the time. In other words, do not vote for the establishment of this new welfare state, because the country might once again plummet into a depression, and so be unable to afford this new provision. His view was rejected, though, and in 1945 the Labour Party won their first general election. They won it on the promise that they would use the Beveridge Report to establish a proper welfare state, including the NHS. The second significant individual in the creation of the NHS is the Labour politician Aneurin Bevan, who acted as Health Secretary. Alongside a remit to provide better social housing after the war, he was given the momentous task of establishing the NHS. Bevan had been a miner as a teenager, and so came from a truly working-class background, and held strong socialist beliefs that it was the government's responsibility to help the poorest in society. He was inspired by a community-led initiative in his hometown of Tredegar in Wales, whereby the local community had paid into a pot of money, and this had been used to provide free health and dental care to all. In a speech to Parliament in 1947, he said that he was simply extending to the rest of the country a service that had worked well in his hometown for decades. Let's now examine the birth of the NHS. The Beveridge Report said that the people should be looked after from cradle to grave, in other words, from maternity services to palliative care at the end of life. It was on this principle that the NHS was born. Let's now examine the different services that the NHS was set up to provide. The first was your local doctor's practice, with general practitioners that act as a person's first port of call when they have a health concern. GPS can prescribe medicines or refer you to a specialist consultant, depending on your level of need. They can also do home visits for those that cannot travel to their local doctor's practice. The most important feature was the provision of specialist treatment for all. This means no person had to fear a life-threatening illness, such as cancer, because they could receive the specialist care that they needed. Larger hospitals were now divided into specialist wards with consultants and nursing staff who were specifically trained to deal with these illnesses. Nowadays, many of these hospitals have medical schools and research centers attached, so that money is invested in providing the very best training and technology, so to deal with life-threatening conditions. The NHS also provides full maternity services to all, including an assigned community midwife, antenatal classes to prepare for birth, and sonograph scans to check the growth and anatomy of the baby. There is also neonatal care for those babies who are born premature, and several health checks on both baby and mother by the community midwife once they leave the hospital. The NHS was first able to offer free prescriptions to all. This was so that people could access one-off medicines such as antibiotics or regular medicines, such as those for long-term conditions like diabetes and high blood pressure. The NHS provided dental services for all, where you could go for any concerns about your teeth, such as when a person has a cavity and needs a filling. They also provided optician services for all those who have a visual impairment. However, it soon became clear that the government could not afford for all these services to be free for everyone. In 1951, an Act of Parliament was passed to introduce charges to optician and dental services, and then in 1952 prescriptions were also charged. Aneurin Bevan was so outraged by this, since it went against the principles of the NHS being free for all, that he resigned from his post. These services are still free to certain demographics, such as children under 18, those on unemployment benefits, and pregnant women. Therefore, even today, those who most need the services do not need to consider the financial cost. Let's now examine the opposition that the Labour government received from the Conservative government, private doctors, and rich citizens. The main reason for this opposition was fear over the cost to the state and the continuation of a laissez-faire attitude that the rich should not be paying out in taxes to provide for the poor. Following Labour's victory in the general election of 1945, the Conservative government acted as the opposition party. During the following months, they voted against an Act of Parliament to legislate for the new NHS a total of 21 times. The biggest voice of resistance was Winston Churchill, who claimed that the NHS was the first step to an economy based on National Socialism. This was a serious accusation, since the Nazi Party had been a National Socialist party. The Conservative Party was supported by upper-middle class, big businessmen, and aristocrats, who still held a laissez-faire attitude, and so opposed the establishment of a welfare state. They could afford to pay for private health care, and so would receive no direct benefit from the NHS. Many lower middle-class families also preferred to use a private practice, but were persuaded by the benefits of the NHS, because they knew the tremendous fees involved in treatment for a life-threatening illness, which of course the NHS will provide for free. The most significant opposition came from private doctors, especially those who operated out of Harley Street in Mayfair, which was known to provide some of the best healthcare in the world, but for incredibly high fees. Bevan's original plan was to get all doctors to relinquish their private practice and to work for the NHS. However, he received a tremendous backlash from the British Medical Association, which represented doctors. In one survey from 1948, the BMA claimed that only 4,734 doctors out of the 45,148 polled were in favour of a national health service. They continued to withhold their support even in the last few months before the launch. As a result of this resistance, Aneurin Bevan had to compromise with the private doctors. He allowed them to continue private practice and continue to charge fees on a part-time basis. At a dinner party a decade later, Bevan claimed that when it came to these private doctors, he had to stuff their mouths with gold to get them to agree to join the NHS. Once Bevan had worked out this compromise, the NHS was born. In 1948, 2,688 hospitals were placed under the direct control of the Ministry of Health in the government. Britain therefore became the first Western country to offer a free healthcare service to all its citizens. Since then, the NHS has received a tremendous level of success and now has cross-party support. This is shown when during the Thatcher years of the 1980s, Conservative politician Nigel Lawson described the NHS as the closest thing that Britain has to a religion. Let's now examine the challenges that the NHS faces today. Whenever a general election comes around, the NHS is the front and centre of the political campaign. One of the most controversial moments of the Brexit campaign was when Boris Johnson stood in front of a campaign bus that had written on it, "We send £350 million to the EU every year, let's fund our NHS instead." This is because the NHS has become the best-loved institution of Britain, and almost all citizens nowadays are against the privatisation of healthcare in Britain. However, the NHS has struggled under the weight of its own success. This is because it now tremendous costs that continue to rise year on year. Whilst certain news outlets would like to attribute this to the rise in net migration, the underlying reason why the NHS is facing these costs is that people are simply living longer. The life expectancy in Britain is now 82 years old, and the baby boomer generation that were born after World War II have now reached retirement age, so are no longer paying into the system. Instead, they are the demographic who are most likely to require a serious operation or ongoing prescription for a chronic health condition. This makes it harder for the government to balance the books. Furthermore, our modern lifestyle has led to public health problems that did not exist at the turn of the 20th century. The baby boomer generation, who are now retired, are more likely to have been long-term smokers, and so at higher risk of lung disease. Many have also indulged too much over the years in alcohol, and so facing liver problems, like cirrhosis or scarring on the liver. There has also been a high increase in health-related problems coming from a high-fat and high-sugar diet, such as type 2 diabetes and heart failure. These conditions are mostly preventable if people lived a healthier lifestyle, but the easy availability of both junk food and harmful substances makes it difficult for people to kick these bad habits. As a consequence of all these factors, is that waiting times for both minor and major treatments has increased. It is not unusual for someone to wait over 4 hours in the A&E waiting room before they receive treatment. Furthermore, the NHS are continuing to miss their targets in terms of wait times to begin treatment for serious conditions. For example, there is a rule whereby cancer patients should receive treatment within 62 days of their diagnosis, but recent statistics show that 64% of patients are not receiving this. During that agonizing wait, the cancer could become more advanced and therefore become harder and more expensive to treat. As a result of these problems, many in Britain now believe that the NHS is a broken system. There have been calls to reintroduce more private practice within the NHS, which is then paid for by the government, since it is considered more efficient. There are also many in Britain who choose to pay for private medical insurance, or to empty out their life savings to pay for major treatment, as they do not want to risk the wait times. In this sense, many would now argue that Britain has a two-tier healthcare system again. The counter-argument to this is that the NHS remains Britain's largest employer, and has some of the world's best specialists working in its hospitals. When someone does need emergency or advanced life-saving treatment, they are moved to the front of the queue and they receive it. Let's now return to our overarching question of why was the creation of the NHS a key turning point? Firstly, it is worth remembering the Beveridge Report. This showed that there were still many living with the 5 giants of poverty, including want and disease. In other words, they were too poor to pay for their own health care, and their poverty also made them more susceptible to a disease. The NHS was born following a Labour victory in 1945. This is because soldiers returned from World War II and wanted something better from their government. It provided free health care at point of entry, including a variety of services like prescriptions, opticians and dentistry. However, the NHS faced significant opposition, especially from private doctors. It took until 1948 for Health Secretary Aneurin Bevan to negotiate and find a compromise so that these private doctors were willing to work for the NHS. Despite the NHS being an undeniable success, it now faces serious financial costs, resulting in longer wait times for patients. This is mainly because we now have an aging population in Britain who require more healthcare, and because our modern-day lifestyle has resulted in preventable conditions, like lung cancer and diabetes. Thank you for watching. This is the final lecture in the Public Health Through Time series. Tune into my other videos for the Medicine Through Time course, including those focused on source annotation and exam writing skills.